So let's go back to Jordan. Maybe you can tell us a little bit more about your pain. And then if you guys want, at the moment, you think about some questions you would love a doctor to answer, we'll come back to that, or you can throw those in too.
Yeah.
Okay. So when I was first diagnosed, one of my first symptoms was like really severe joint pain. And that's kind of how the GPA came on for me. It started in my like hands and then moved to my feet and then moved pretty much everywhere else. And it got really, really intense to the point where like I couldn't really walk. Luckily, that's not where I'm at now. Um, but I have gone through a few flares since I've gotten diagnosed. And a lot of my like day-to-day pain is probably more like neuropathy related at this point. I get like a lot of neuropathy in my legs, which I'm on gabapentin for currently. And then also just a lot of like lung pain, airway, sinus pain because I have inflammation in my airway and my sinuses. So, yeah.
Okay, that's good information. Shelley, you want to tell us about yours?
My pain is mostly in my feet. Um, I like to joke. I go to physical therapy for the drop foot, and I like to joke with them when they ask me if I'm in pain, and I say no, but that also means I'm at like a level 2 or 3.
Mm.
Well, to me, that's my base pain. That's a 24/7. Anything above that, I count. Um, and it is a 24/7 pain. And it goes, every day is different. Every day, I can never tell you the same day how each foot is going to feel. Um, it's very hard to walk with the pain. I currently am also on I'm on pregabalin, I'm on oxycodone, and I'm on duloxetine for the pain, and also for anxiety. Um, and there's no making it better. And I think one of the questions I would like to ask the doctors is there a way to make it better?
Hmm.
Can it be made better? Um, it, the way I cope with my pain, besides the medication that I take, is I sleep. I
Mhm.
just sleep. And if I'm sleeping, I don't feel it.
Hmm.
So, and it's made it very difficult to do anything socially, to go out. It's very difficult. It makes it very hard to walk with my walker. Um, that's kind of where I'm at right now.
Okay, well, thank you for sharing that. Appreciate it. Um, Charlie, I think you have a interesting story that I want to ask about, but you tell us where you are and where your pain is, please.
Well, my pain is predominantly in my left foot and lower left leg, with the primary place, the left foot. And my pain is because the vasculitis attacked my nerves in my legs. And so a lot of my nerves just died, and they identified that through a sural nerve biopsy. Um, and at the time, um, I was sort of grasping at anything I could, and I did um, get a spinal cord stimulator to try to control the pain. And at first, it seemed to be working, but now I'm pretty much convinced it was my adrenaline that was working and really wanting the stimulator to work. And in the end, the stimulator really began to give me more trouble than anything. And so I turned it off, and it hadn't been on for a couple of years, and I will have it removed at some point. Um, for control of my pain, um, I take Percocet, Lyrica, duloxetine, um, all those things to control the pain. Um, one of the problems that um, I've had over the course of the last few years is that I had to have 2 full knee replacements. And so that, of course, caused a lot of pain anyway. I have pain every day. Every day it's about a 5. It manifests itself in different ways, but mostly aching. But sometimes I'll have like bee stings going on or electroshocks or something like that. Um, I went through a terrible period of depression about a year ago in relation to taking Percocet because there's such a negative connotation to taking opioids. And if it hadn't been for the Vasculitis Foundation support groups, I would have gone crazy because, they were able to help me understand that because I tried to get off the opioids a couple times. And the lower I would get in the dosage, I mean, I couldn't operate. The pain in my legs, because when I wake up in the morning, it's, it's pretty bad. And so until I get up and take some medication, etc. So I think there's a story there. I don't know if that's something that needs to get told here. And I don't know how many people who have vasculitis take opioids, but, as soon as you say you're taking opioids, people look at you like, you're an addict. Um, you're out on the street buying opioids. And so my pain is no better than it was 4 years ago. I cope with it better than I did 4 years ago. And I um, I don't know what to say other than that.
Okay, well that was very helpful. I was curious about your spinal cord stimulator, and it's interesting to hear that perspective, and I do think you should share that part.
I was told, Jordan, by my doctors that in Arizona, they cannot prescribe opioids to you at all, that you have to go to a pain management doctor. And
Okay.
that's what I had to do. I asked all my doctors, and every one of them said you have to go to pain management. And I went to a pain management doctor, and it was almost too easy.
Yeah. And
Which is kind of scary, but
that's
I'm glad I
another,
got them.
yeah, and that's another one of the questions on my list is what is the role of a pain management doctor? Because that has been brought up in my treatment recently. And I don't know a lot about pain management or how that works. And just kind of how to integrate that into your care, I think would be really valuable insight from the doctors. So
Yeah.
And we've had,
I see a pain management doctor.
mhm,
I go to a pain management doctor along with all the other doctors.
yeah.
Yeah.
we had a conversation with a woman, a doctor who worked in the ER, and that was remember, Kathy, we talked to Nancy, I think her name was, about it, what the frustration and the challenge of going to the ER with vasculitis and having to try to explain needing pain medicine and the headwinds you hit there. So
Yeah. And Greg, I'm gonna let you talk now. I will
Yeah.
say that I have a family member that goes to a pain management clinic, and that is the only way he makes it through life. And it took a while to get to that place. So I'm really interested to hear if sounds like all or most of you who are living with the chronic pain are in need of that. But you go ahead, Greg.
Yeah, thank you. And like I said, I'm actually, as today went along, I was thinking about being on this call and really getting excited because Yeah, thank you. And like I said, I'm actually, as today went along, I was thinking about being on this call and really getting excited because not only being a patient with vasculitis and having pain and having some crazy episodes with pain over the last 3 years, I'm also a clinician. And I work in a very small PT university part-time. I do home care full-time and I have a very small adjunct role. And I'm sad to say, or not sad, I'm actually excited to say I'm probably throwing in the towel with mainstream healthcare because it's just broken. And at the college, I can do whatever my patients want to do and what we feel like they could benefit best. Well, as I was thinking about this topic, I've been fortunate. I've had episodic pain. Now, when I've had it, it's been hospitalization type status, really bad to the point I had or what's called arachnoiditis. And everybody on this call knows when you go to the ER, they just look at you like you have three heads. We've kind of heard of this when we were in school, but I don't know much more than that. Can you tell me, where you're at and what helps you the best? The episodes I've had with severe pain, one was like Jordan was saying, initially I had just severe nasal destruction, damage, lungs. That was horrific pain. I never thought I'd ask for morphine. Being a PT, it's just in my nature. I tell my patients, don't get me wrong. I am not against pain medicine and pain medicine control because sadly, our pharmaceutical industries let us down and that we don't have many options. The good news is that if we figure out what's causing the pain, find that root source, that's going to be more effective. And then as an adjunct, our medications can help temper that down. And I've experienced it myself where I was so blessed. I never had pain in my life. I'm a long distance runner. That hurts. I like that kind of pain, but I never had physiologic pain from a disease. And going through it myself was actually what I say, I look at it as a good thing because I can appreciate not only, what my patients are going through, but better understand my body. Anyway, um, there is so much evidence out there in the literature that I tell my patients, when you think about pain, and I see a lot of people with pain for all different reasons, from whether it's total joints, neuropathy, particularly diabetes. And I look at us kind of like a diabetic patient. And I look at myself that way because it's really a vascular problem. The diabetes is not a sugar problem, it's a blood vessel problem. And so if we can figure out what's causing my pain, I can look for a physical agent to improve that circulation that thereby maybe could make a significant difference where the opioids and all, they're band-aids. It's the only band-aids we've got, so we've got to use those. But there is so much happening right now in the area of pain management where we're learning this is the most powerful tool we have. And so as I was thinking about this call today, like I said, I've been fortunate. I've not had consistent chronic pain, but I've had and probably will still have very severe episodic pain. So I can at least appreciate what everybody else goes through.
I did. I did. Greg, it's the things that you were just saying um, are the kinds of things that make someone. I shouldn't say make someone. It makes me feel ashamed for taking opioids, but that's the way it sounded. Because just because you find the reason for the pain doesn't always mean that
Right.
you can,
It
the reason I have pain is because my nerves are dead.
right. They're dead.
And so um I'm 72 years old. I have what, maybe 20 years left, and I
Uh,
want the quality of my days to be good.
right.
And um I
So I think that's the,
I don't want to feel shame for
yes.
taking an opioid if that's the only thing that I've been able to find that
And
doesn't take care of it all, but it
it pulled it
it
down.
blunts the pain. Mhm.
Right. And I think y'all are probably all like me. When I go to the doctor, you're almost feel embarrassed to mention pain.
Mhm.
You know, I can talk about my breathing problems with my pulmonologist all day long. And he's like, yeah, we got to get this fixed. We got to do another bronchoscopy, you know, in a couple of weeks and make sure, you know, you're not getting, you know, your infections sparking up. But pain is one, it says has such a horrible stigma. And it's like, that is so unfair to all of us and everybody else. And I think that's the thing. If I mean, this is obviously a big problem in our country or in the world, but I think that's the thing where we don't have, it's kind of like making a soup. You've got to put the chicken stock in, and that's the opioids or the pain control medicines. We don't have a choice but to use that chicken stock. But are there other things we can add to that that would pull down the
Mhm.
dependency on those that actually, and sadly, and y'all all know this, and I've been through it myself. Yeah, they help, but we're still all dealing with it.